Hello everyone, welcome to sqadia.com. I'm Hina Khan and today the topic of our lecture comprises of the bipolar affective disorders. So basically affective stands for the mood disorders that we're talking about today, and bipolarity basically signifies the fact that we're talking about a person who has two extremes to his personality. On one hand, he's in a depressive mode, and on the other hand, he is in a state of mania. So this is what we are going to discuss today, and basically the lecture comprises of these sections. In the first section, we'll be discussing the associations along with the risk factors that make you a personality more vulnerable or prone to these bipolar affective disorders. So obviously the clinical presentation is again very important when we talk about it, and if you get a patient in your outpatient departments and he gives you a history of depression and you basically correlate this history with a parallel history that is taken from his friends and relatives, you'll get to notice and you will get to basically diagnose the case if he is suffering from the bipolarity or not. So this is very important. We'll give you the definitions in this first section regarding the bipolar affective disorders, and moving on we'll be discussing the prevalence of disorders as well, how commonly it is diagnosed, and sometimes it is in a subnormal state and still it is a disorder and it has to be treated and medical intervention is required even in this case. So risk factors, we'll be discussing them in detail over here in this first section. In the second section, we'll focus on the bipolar symptoms primarily. So the signs are important clinically, but the symptoms that the patient will describe in his or her own words, this is again very important. And the clinical features, mania and hypomania, how do you basically distinguish? It's basically quite an arbitrary terminologies that are being used. But still, it's quite subjective as a clinician or as a psychiatrist when you see patients to distribute them or to categorize them in mania or if they are in a hypomanic state. Then mixed affective states, they're again very commonly seen clinically, and neuropsychological dysfunctions, they'll be discussed over here in the second section. In the third section, we'll be moving on with the bipolar diagnosis over here, and the course and the outcomes will be discussed in detail, and then we'll be discussing the assessments depending upon these courses and depending upon the outcomes after the medical interventions and even before the medical interventions. Then we'll be discussing the differential diagnosis over here. In the fourth section, we'll be discussing the bipolar disorder treatment, or how do you manage a case of bipolar affective disorder. That will also be discussed over here. The manic episodes are, of course, they have their clinical significance, and we'll basically routinely examine these manic episodes, but there is a phase of depression that is more prominent in such disorders. So even that will be calculated, or that will be assessed by the clinician or by the psychiatrist. The depressive episodes and the prophylactic medications that can be used to prevent these manic or the depressive episodes, they're again important, and the psychological therapy that will go side by side, hand in hand, along with the medications. The counseling sessions, they'll be discussed, and what are they going to comprise of, they'll be discussed in the fourth section. In the fifth and the final section, we'll be discussing other mood disorders that can clinically be presented to you in the outpatient departments. We have these seasonal affective disorders in which the mood is affected by the seasonal changes, and then we have the childbirth and affective disorders. Postpartum depression is one of the mood disorders that is quite commonly seen. Postpartum psychosis. So these are the common phenomena that are seen. The premenstrual depression, it's again quite important when we talk about the women and depression. So all of this will be discussed over here in this lecture. I hope you want to learn more about these bipolar affective disorders. So do watch the other sections to this lecture as well.